Hey, everybody, and welcome to like a deep dive, into something I think we all need a little help with sometimes, right? Like communication skills.
hmm
You sent this over as some classic nursing student materials. And at first I was like, all right, communication models, Shannon Weaver Schramm.
Yeah.
I'm like, oh boy, this is going to be exciting. But then I really look at it and it's kind of cool because it really boils down to like send a receiver message.
Right.
Pretty
Yeah,
simple, right?
it is.
So help me out here. Why does like a regular person like me who's, maybe prepping for a tough conversation with my boss.
Yeah.
Why do I need to care about communication models?
I'm so glad you asked that because it's deceptively simple, right? It's like
Yeah.
when we think about these communication models, we think, oh, those are just for like,
Nursing 101.
nursing 101, but they're really not. They're like the x-ray of a conversation. So anytime you have a breakdown in communication, whether it's sending an email to your boss that totally missed the mark or having that misunderstanding with a friend, you can literally pinpoint where it went wrong.
Yeah.
Was it the sender? How you said it? Was it the channel you used to communicate? That was it noise?
Okay, noise that I get.
Yes.
So I'm assuming noise is not always like
Exactly.
literal noise, right?
Exactly. Noise, think of it as anything that distorts the message. So that could be internal distractions, that could be assumptions we're making, that could be jargon the other person doesn't get.
Yeah.
Like just last week, I was trying to explain a project update via email,
Yeah.
and it was like talking to a wall.
Oh, yeah.
And so it wasn't until I actually got on a quick Zoom call with this person and we talked it through that clicked and I realized the noise was that we were missing that nonverbal,
Interesting.
that tone of voice.
So you're already like proving your worth here at the deep dive,
Yeah.
bringing in the real life examples.
Well,
I love it.
got to keep it real.
But it's the perfect segue because the next thing I wanted to hit on was the whole verbal versus nonverbal, which this nursing material gets into. It lists out like 4 modes of communication:
Yeah.
verbal, nonverbal, electronic, written. But it's that nonverbal stuff
Yeah.
that I think trips everybody up. I
It
mean,
does.
I could be like, oh, yeah, that's a great idea, and like roll my eyes.
Yeah.
Totally different message,
Yeah.
right?
Absolutely. And I would say that nonverbal communication is probably the most underestimated aspect of communication, even for people who think they're good communicators.
Mhm.
I think we're all guilty of being a little bit oblivious
The-
to our own blind spots, right?
Yeah, for sure. So do you have any good stories about like misreading a nonverbal cue? Just so I can
Yeah.
feel better about all the times I've done it?
Oh, absolutely. Expert speaker shares brief, relatable anecdote about misreading a nonverbal cue that illustrates the point and adds a touch of humor.
Oh man, I'm never going to live that down.
It was a humbling reminder to pay closer attention to those subtle signals
Mhm.
because I think we focus so much on what we're saying
Right.
that we miss what the other person is silently conveying through their body language.
That's both hilarious and mortifying.
It is.
Okay, so we got to be mindful of those nonverbal cues, right? So we're getting good at like reading body language, but what about the actual words we use
Mm.
and how we use them? This nursing material gets into different communication styles.
Yeah.
And it's so relatable, even if you're not like wearing scrubs to work every day, you know?
It's fascinating how much this applies across the board.
Totally.
You see these patterns in every workplace, every family dynamic,
Yeah.
even how we interact online.
Oh, for sure.
Right.
So you've got your passive communicators,
Yeah.
maybe they avoid conflict, they don't speak up when they should.
Right.
And then there's assertive, which is like direct, honest, but still respectful.
Right.
And of course, we've all met them,
Oh,
the
yeah.
aggressive
Well,
communicator. But there's one more that I think a lot of people can relate to.
Okay.
Passive aggressive,
Yeah.
seems nice on the surface,
Right.
but there's that like little edge to it,
Yeah.
you know? Oh no, it's fine that you forgot to do that thing I asked you to do,
Ouch.
you know?
I think I felt that one.
Yeah, exactly.
Yeah.
So we've got these styles defined. But it's one thing to read about it. How do we figure out our own dominant style?
Right?
And more importantly, how do we adjust it, like, depending on who we're talking to?
Yeah, that's where that self-awareness comes in.
Because let's be real, like, if you're in a delicate negotiation, you probably don't want to go full-on assertive.
Exactly.
Yeah.
Exactly. You're not going to get very far.
So how do we figure out what our own style is so we can adjust?
It's really about looking at ourselves honestly and saying, okay, am I typically passive? Am I holding back?
Right.
Do I tend toward that more aggressive communication style, or am I somewhere in between? And then once we figure out what our natural tendencies are, we can make those conscious choices about how we communicate based on the context that we're in.
Okay.
Because you're right, there's no one-size-fits-all approach to communication.
It's like having a communication toolkit.
I love that.
And you're choosing the right tool for the job.
Exactly. And to your point about adjusting to the situation, right? The
Yeah.
source material gives this great example of like,
Okay.
you know how a client's state, whether they're anxious or confused or in pain, impacts their ability to communicate.
Hmm.
And nurses are trained to kind of adapt their approach based on that.
Oh, interesting.
And I think that applies to any interaction if you're dealing with someone who's stressed out.
Yeah.
Taking a more empathetic and patient communication style is going to get you a lot farther.
It's like that saying, don't try to have a rational conversation with someone when they're in the middle of an emotional hurricane.
Exactly.
You kind of just got to like ride the waves a little bit.
Yeah.
Okay, so we've got our communication styles somewhat sorted. We're becoming masters of nonverbal cues.
We're getting there.
But then this nursing material throws this curveball.
What's that?
It's called communication barriers.
Okay.
And it's literally a whole list.
Okay.
And it's kind of overwhelming, to be honest.
It's like what kind of things?
It's language differences, cultural differences,
Hmm.
impairments, medication effects, even just like a bad mood.
Mm-hmm.
And I'm reading this and I'm like, so basically they're saying here's every reason communication can go wrong.
It does seem like a daunting list, right?
It does.
But I think being aware of those potential barriers is the first step toward overcoming them.
Okay, I like that. It's like if you know the landmines are there, you can be a little more careful about where you step.
Exactly.
So if you could give our listener just one key takeaway to improve communication despite these barriers, what would it be?
If I had to choose just one, I would say cultivate the habit of active listening and seeking clarification.
Okay.
And what I mean by that is, effective communication isn't just about expressing ourselves clearly.
Mm-hmm.
It's equally, if not more important, to truly understand the other person's perspective.
Oh, that's a good point.
And that means actively listening to what they're saying, paying attention to their nonverbal cues, asking clarifying questions to make sure that you're really understanding their meaning.
It's so true, though, because I feel like I do this all the time. I'm like half listening and already thinking about what I'm going to say. And then I'm like, wait, what were you saying?
Right, exactly. And we miss those important details.
Okay. Active listening, going straight into my communication toolkit.
I love it.
So we've tackled communication models, styles, barriers.
We have.
But, me, I like to bring things back to like, okay, but how do we actually use this?
Right.
So that's where our second source comes in. Student NURS 101. Documentation.
Yeah.
KeyKeyTag.pdf.
Documentation.
Now I know what you're thinking.
It sounds thrilling.
This is going to be riveting.
Right.
But as I was going through it, I had this like aha moment because at its core,
Okay.
it's about the importance of clear and accurate records.
Okay.
And that is something
And we can all relate to.
that we can all benefit from, no matter what field we're in. I mean, let's be
Yeah.
real. Who hasn't had like a project go sideways because their notes were a mess?
Oh,
It's like my past self was trying to sabotage me
yeah.
with
Yeah.
bad notes.
But what's interesting is they break it down in a way that's really helpful even outside of healthcare.
Oh,
Like they emphasize the importance of being factual.
okay.
And they give you this great acronym to remember it.
Okay, I like it already.
Factual, accurate, complete, timely.
See, that's what I'm talking about, like factual.
Right.
It's so basic,
Right.
but I'm telling you that acronym really hit home for me because I actually had like this miscommunication with a client because my project notes were a mess.
Oh, no.
And it almost like cost us the account.
Wow.
And I was like, if I had just followed the factual method, this whole thing could have been avoided.
Totally. And it's not just about avoiding those communication disasters.
Right.
Good documentation can actually be like a superpower in today's world.
Okay. So
Think about it. Clear notes help you track your progress on projects. You can make better decisions. You can even like spark new creative ideas.
okay.
It's like leaving yourself breadcrumbs so you don't get lost.
I like that. Okay, so it's not just about getting the facts straight.
Right?
They also talk about avoiding abbreviations and jargon,
Yes.
which honestly, I need to be reminded of this like all the time.
Right.
Because in my head, ASAP is very clear.
Right.
But is my future self 6 months from now going to know what that means?
Exactly. It's about having that long-term vision, right? Who are you writing these notes for? Is it for a colleague? Is it for your future self?
Yeah.
But clarity is key.
Clarity is key.
Mm-hmm.
I like it. And then the last thing I wanted to touch on that they mentioned
Yeah.
is correcting errors transparently.
Oh, yeah.
No like whiteout, no like scribbling it out.
Mm-hmm.
It's like own your mistakes.
It's about accountability, right?
Yeah.
Whether it's a patient's medical chart or a legal document or even just our own to-do list,
Totally.
accuracy and transparency have to be the goal.
I love it. So we started with these nursing student materials on communication.
Yeah.
And I got to be honest, I was like, okay,
How much are we going to get out of
how
it?
much are we going to get out of this? But we've covered everything from like deciphering nonverbal cues to choosing the right communication style for the situation to like the power of good documentation.
And I think it just goes to show that you can find these valuable insights in the most unexpected places.
That's what we do here at the Deep Dive. We find those hidden gems of knowledge.
We-
And for you, dear listener, here's something to think about. How can you use just one technique from today's Deep Dive, whether it's active listening, being mindful of those nonverbal cues, or even that factual acronym
I love it.
to level up your communication this week?
I'm going to try that.
Give it a try. Let us know how it goes. You might just discover your communication superpower.
Right. And who knows, maybe I'll finally decipher my own handwriting.
I wouldn't hold your breath on that one. Thanks for joining us for another Deep Dive.
This is a good one.
I'll catch you next time.